Hey there, orthopedic enthusiasts. It's me, Jason Coggins, physician assistant and educator with basicsofOrtho.com. Today, I want to talk about one of 3 foot and ankle conditions that I wrote about in a recent blog article titled Common Conditions of the Foot and Ankle Associated with a Trip to Walt Disney World. I love Disney World. My family loves Disney World. I can't get enough of it. I could go multiple times a year, but there is a lot of walking associated with that. The average person takes 18,000 roughly steps a day in Disney World. That is a lot, especially in comparison to how much we normally walk during our normal daily lives, which is estimated at around 3,000 to 4,000 steps a day. So a huge difference, and that predisposes us to lower extremity overuse injuries. So the 3 conditions that I talked about were plantar fasciitis on the bottom of the foot, posterior tibial tendinitis along the medial aspect of the foot, and then Achilles tendinitis posteriorly. So today I want to focus on posterior tibial tendinitis. So let's get started with the anatomy of it. So the posterior tibial tendon and muscle originates on the posterior tibia and interosseous membrane. It traverses medially, posterior to the medial malleolus, and attaches to the navicular tubercle medially at the top of our arch. Its functions are threefold. One is it helps hold that medial longitudinal arch with each step we take. 2, it aids the plantar flexors and plantar flexion of the foot. And then 3 is it helps with inversion of our foot. So 1 holds up the arch, the medial longitudinal arch that is. 2, it aids in ankle plantar flexion. 3, it aids in foot inversion. Now all 3 of those things are very important and are involved with each step we take. So again, if the more steps we take, the more that predisposes us to developing an overuse syndrome of that posterior tibial tendon. So how do you know that you have posterior tibial tendinitis? In the acute setting, there's generally a lot of inflammation associated with that. So you'll have symptoms associated with inflammation, pain, swelling. You may even feel a little bit of popping or crepitus type sensations, but mainly pain and swelling. And they'll be located on the medial ankle, particularly slightly posteriorly. From a physical exam standpoint, you may have an antalgic gait if it hurts bad enough. From inspection standpoint, you may notice swelling along the posterior medial ankle. From a palpation standpoint, they'll be tender anywhere along the distribution of that posterior tibial tendon. So anywhere from the posterior medial tibia, traversing posteriorly to the malleolus, anywhere to its attachment on the navicular tubercle. And then they'll have pain with usage of the tendon. So again, think back to its actions. It helps hold up the arch. So if you step down, that arch falls and that secondarily pulls on that posterior tibial tendon, so it's painful. 2, again, it aids in ankle plantar flexion. So resisting plantar flexion manually can sometimes elicit pain. Or if you really want to stress it, have them do a toe raise, so going up on their toes. If that's painful, then that is a symptom of posterior tibial tendinitis. And then lastly is inversion. So if you have the patient slightly plantar flex and invert their foot, and then you resist that manually, and that causes pain, that's another symptom of posterior tibial tendinitis. So what do you do about it? Well, you want to reduce that inflammation. So ice at least 3 times a day for about 20 to 25 minutes, and inflammatory medication if appropriate for the patient. You certainly don't want to give any anti-inflammatories when contraindicated. That can be orally or topically. And then you want to relieve some of the stress that posterior tibial tendon is taking. So that can be in the form of an ankle brace. I have used that. My personal preference is using arch supports. There are some good over-the-counter arch supports that I prefer. Superfeet is one, soft sole, and then sole. There are other good ones out there as well, I just don't have experience with. And then you want to rehab that posterior tibial tendon. You really want to work on flexibility and stretching of the posterior heel cord and Achilles tendon. So anything that drives the toes towards the nose stretches that posterior ankle. and Achilles tendon complex, as well as the posterior tibial tendon. And then you want to work on strengthening as well. That can be in the form of home exercise programs. There are several that you can find on the web. I personally use the American Academy of Orthopedic Surgeons home ankle conditioning program. You can prescribe formal physical therapy as well for more intensive therapy. Hopefully, after initiation of these measures, there will be considerable improvements. So, what do you do if you still have a few more days left in Disney World? Well, ice. Know where your ice bucket is wherever you're staying, so you can try to ice it 3 times a day. If appropriate and not contraindicated, oral anti-inflammatories regularly as indicated from the packaging. And then stretching, regular stretching. Disney World, and any other theme park for that matter, you're going to have to wait in line. So if you're standing in line waiting, don't waste that time. You can use that time to stretch, and that can be helpful. Also, you can procure a pair of over-the-counter orthotics that may help you out and finish out that trip strong. So I hope you've learned a thing or two about posterior tibial tendinitis. If you haven't learned anything, hopefully you've reviewed it. And if you've enjoyed this video, please hit the like button and subscribe to the channel. Thank you, and I hope you join me next time.